Hi and welcome to Pharmacy Skills. In this video we'll look at tetracyclines. So with tetracyclines we can remember them by the suffix. They end with cycline. We have tetracycline, doxycycline, minocycline, and that's just to name a few. How do these drugs actually work? Well, tetracyclines reversibly bind to receptors on the 30S ribosomal subunit of the bacteria. This therefore inhibits bacterial protein synthesis and also inhibits cell growth. Tetracyclines have various indications including chlamydia, rickettsia, acne, rosacea. Some of the more common side effects that are often reported include GI disturbances and antibiotic-associated colitis, which is going to be more common than it is with the other antibiotics we've discussed so far. There is also dysphagia, that's difficulty with swallowing, esophageal irritation, hepatotoxicity, blood disorders, photosensitivity. It's an important one to remember. We also encountered this with quinolones. Then there is hypersensitivity, headache, and if a patient experiences visual disturbances, that might indicate raised intracranial pressure, which means you need to discontinue treatment. Let's look at some of the contraindications and cautions. As discussed in the side effects, you'd have to caution this with hepatic and renal impairment. You want to avoid in children under 12. And the reason you'd want to avoid it in children under 12 is that they can deposit in growing bones and they can also stain teeth permanently. You want to avoid them therefore as a result in pregnant and breastfeeding women. Tetracyclines may also increase muscle weakness in myasthenia gravis, and therefore that is contraindicated too. And they may also exacerbate systemic lupus erythematosus. Other points to consider is that antacids, aluminium, calcium, iron, magnesium, and zinc salts decrease the absorption of tetracyclines. Milk may also reduce the absorption of tetracyclines. Tablets and capsules should be swallowed whole with plenty of fluid while standing or sitting to avoid irritation of the jaw or the throat. Doxycycline should be taken with food. We're also going to cover daptomycin here. Daptomycin is a naturally occurring lipopeptide antibiotic that kills susceptible gram-positive bacteria by disrupting their membrane potential. It is found in soil bacterium called Streptomyces rosaceoporus. It is similar to vancomycin in its efficacy, however, its activity against enterococci has not been established. If there is unexplained muscle pain or tenderness, weakness, or cramps that develop during treatment with daptomycin, you'd have to measure the creatine kinase every 2 days, and then you have to discontinue the drug if there is these unexplained muscular symptoms with significantly elevated creatine kinase levels.